Both the virus and the economic hardship that resulted from it have hit some parts of the Greater Toronto Area much harder than others. How come? In collaboration with Ryerson University's First Policy Response, we've assembled an expert panel to think about how to understand those disparities and to ensure a more equitable economic recovery. Let's introduce them, all in Ontario's capital city. Deputy Mayor Michael Thompson, Chair of Toronto's Economic and Community Development Committee. Jeffrey Schiffer, Executive Director for Native Child and Family Services of Toronto. Nakima Ray McMahon-Amna, Director of Policy and Research at the Canadian Black Policy Network. And Jennifer Yang, Health Reporter at the Toronto Star. Welcome to you all. Very happy to have you all. I know some of you, it's your first time, so it's nice to have you on the program. And just to set the table for our discussion, we do have a few maps I want to get through. So Sheldon, if you could please bring in the maps. Here's a map of the city's COVID-19 cases to date. Lots of cases in the northwest part of Toronto and parts of Scarborough. A couple of hotspots in East York, downtown, and Etobicoke, and very few cases in Midtown. We have another map here, and here's a map from the 2016 census of low-income neighborhoods in Toronto. Again, we see parts of Scarborough, the Northwest, East York, and downtown with higher percentage of low-income neighborhoods. Jennifer, I wanted to ask you the first question. We do see maps of Toronto, but obviously what's happening is not just isolated to the 416, correct?
That's right. The same patterns that we've seen playing out in the city of Toronto, where lower income neighborhoods, where more people are essential workers, more people live in cramped housing, are at higher risk of COVID-19. That's a pattern that's held true across not just the province, but the country and in other parts of the world as well. So some of these patterns you're seeing where the dark shaded parts of the map are sort of aligning with where people are also more lower income and working a lot of these essential jobs where they can't stay at home. That tends to be where COVID cases have concentrated.
And Deputy Mayor, what do these maps tell us about the unequal impact of COVID-19?
Well, I think the map tells us a lot, but I think it's really important for us to understand that COVID didn't create this problem. In fact, this problem existed well before COVID. And really what it's demonstrating to us, though, that we have to act, we have to help people. And as has been stated before, the conditions of cramped housing, the conditions with respect to many of the frontline workers who are from specific areas who are, predisposed to other issues such as lack of appropriate housing, food insecurity, lack of education, and so on. And so what it tells us is that we have lots of work to do. And in fact, we have to put not only policies in place and not only relying on government to actually do everything, but it is a collaborative approach as a society that we have to take the next step in order to address this inequality. It's intolerable that these conditions have been allowed to fester, and the pandemic has definitely shown us that there is a tremendous gap that has existed in our society that really needs to be addressed, and efforts are actually being made to address those. But at the same time, while we take these necessary steps and efforts to address them, we also have to measure for impact, because if we don't measure for impact, we will never know whether or not we're being successful.
And just to build on what the Deputy Mayor said, Nakima, he said that some of the conditions that we're seeing right now existed before the pandemic. The title of tonight's program is Equity, Economic Recovery, and COVID-19. What does equity look like to you?
Yeah, I think it's a great question because equity is a word that, especially since all of the activism that we've seen over the course of the summer months, that has been tossed around a lot. But I think it's really important that we define the word. So equity for us is really about understanding that some communities have been disproportionately impacted by this pandemic. Those communities are reflected in geographic areas, but also ethnocultural communities. So we're focused on looking at the overrepresentation of Black communities in the number of COVID-19 cases. So when we think about responses and our economic recovery, equity means actually ensuring not just a one-size-fits-all approach, but targeted approaches that are actually going to address not just the crisis response to the disproportionalities we're seeing right now, but addressing the systemic issues, the root causes, the reasons why these disproportionalities have existed in the first place.
And Jeffrey, to build on what Nakima was saying, when we do think about recovery, one size fits all might not be what we're looking at. For the Indigenous community, how has the pandemic impacted the inequalities that the Indigenous community are experiencing in the city?
Sure, yeah. So, my fellow panelists have really hit the nail on the head with a lot of it. I think we're seeing Indigenous people in really dense urban environments where they need to go to work on overcrowded transit systems on a daily basis, and we're seeing rapid spread. But I think we also need to remember that this is not the first pandemic Indigenous people on Turtle Island have experienced, and there's a lot of intergenerational trauma about historical pandemics that have impacted communities. So, alongside the historical issues that have been made more acute related to poverty and housing, we're seeing this secondary shadow pandemic related to mental health and, in some cases, substance abuse and family violence that is really becoming more acute in the face of this pandemic.
What you just said was really interesting in the sense that this is not the first pandemic that the Indigenous community has experienced. Why is that important for us to acknowledge?
I think it's important because we need to recognize that people are dealing with a lot of intergenerational trauma right now, and we need trauma-informed land-based tools and practices to be able to address the way that this pandemic is impacting Indigenous people. It also has a lot to do with vaccine hesitancy, right? Because Indigenous people have a very long history of, in fact, experimentation at the hands of settler medicine. And so when we tell Indigenous people now that they're a priority group for a vaccine, there's a lot of hesitancy around that because of historical trends. And so we're also working very hard to combat vaccine hesitancy right now in the community.
We were going to talk about vaccine hesitancy, but because you brought it up, I suppose we can go there right now. A lot of the discussions that I've been hearing when we do talk about vaccine hesitancy, it's kind of in the way that the responsibility is put on those communities to not be vaccine hesitant. Nakima, how should we be approaching this conversation?
Absolutely. You're right on that the conversation around vaccine hesitancy has been really individual and has mostly focused on addressing the misinformation that is out there. But as my fellow panelists noted, in Black communities, the systemic anti-Black racism in the healthcare system has had disastrous and fatal impacts for Black communities. So there are warranted low levels of trust between Black communities and healthcare institutions. And I think, earlier in this pandemic, there were some ideas around dedicated testing centers in those communities that were disproportionately impacted by the number of COVID-19 cases. And when we were talking to folks on the ground in their communities, they were like, I'm not so sure about this testing center. Our community is already so over-surveilled by police, by child welfare intervention. This just feels like another thing that's coming into our community, and we're not really sure about it. So combating vaccine hesitancy, I think there's been a lot of work to put accurate information out there, information that's accessible, and there's starting to be some work ensuring that that information is available in multiple languages. But I think how information about vaccines is distributed is another key component. So there are many Black-led organizations like the Black Health Alliance that are working on the ground in communities to be the voice distributing some of that information because they are trusted sources of information in the community. I'm really looking forward to understanding how, as the vaccine rollout takes place and is led by Toronto Public Health, they're going to be able to partner with Black-led organizations to support some of that distribution and combat that vaccine hesitancy.
And Deputy Mayor, I saw you nodding.
Yes, I'm just nodding because she's right. And in fact, that work has already been started. And it is very important that it's the grassroots organizations that our municipality is actually working with, because they're in the community. The community members know who they are. They are a trusted source of information and so on. Let me also say that it's extremely important for members of the community to ask questions and to be hesitant about taking the vaccine and so on, because, we've seen time and time again, and I know I participated on a forum last Saturday, and they talked about the Tuskegee experiment on Black people many, many years ago in the U.S. And those types of memories still linger. And, with respect to the systemic nature of racism and discrimination and so on, we've heard, people in the scientific community, not in Toronto, but International who talk about experimenting on Africans and so on. And those types of information actually is cemented in people's mind and their mindset. So there is a reluctance of acceptance, and there's a trust factor. But at the City of Toronto and with our Board of Health and our Toronto Medical Health, we have recognized the need to partner and to work with community organizations, and that requires us to invest with those organizations, and we are actually doing that work right now, because that's the only way that you're going to get cooperation.
And I want to go back for a moment to the map. And Jennifer, the northwest part of the city looks like it has been the hardest. Why is that the case?
So at the Toronto Star, we took a look at this question early in the spring when the first neighborhood map was released by Toronto Public Health, showing which neighborhoods had been hardest hit. And it was so striking to see that the northwest corner was really where cases had been concentrated in the city. And, we asked that question, why is this? And we tried to dive in and take a look at what might be going on. So our starting point was to ask, well, in lockdown, where are people possibly getting exposed to this virus? It's at work, it's at home. And, you also ask questions about access to healthcare and testing. So we kind of looked at those three areas. And what we learned was that in the northwest corner, it just happens to be that a number of issues, a number of factors are aligning to sort of create this perfect storm of vulnerability to the virus. And what are those factors? More people working in low-wage essential jobs. For example, one community in the northwest corner, Mount Olive, that has had some of the highest cases since the beginning of the pandemic, has some of the city's biggest proportions of people working in manufacturing jobs. They also have some of the highest proportions of people living in unsuitable housing. So too many people cramped into a single household. And then you look at access to healthcare. In the northwest corner, historically, some people have referred to it as a primary care desert. There's just really poor access to primary healthcare. And when we got more data looking at testing access, this was also a part of the city where testing rates were really, really low. So all of those factors aligned and put the northwest corner of the city at highest risk.
Have lockdowns had any effect in reducing the spread, Jennifer?
So lockdowns do have an impact, but what we found was that in these higher burden neighborhoods, the measures put in place by policymakers take longer to come into effect in these hardest hit areas. So we did an analysis where we looked at the first spring lockdown and we compared how it impacted some of the wealthiest neighborhoods in the city where racialized populations were lowest. And we compared it to neighborhoods that were some of the lowest income where racialized populations were highest. And we found that the first spring lockdown almost immediately flattened the curve for some of these more privileged neighborhoods. But cases, in these lower income areas continued to rise for a while before they started to come down. So some of these light touch measures that will work immediately or quickly for a lot of the more affluent neighborhoods in the city and beyond, those measures just take a lot longer to come into effect and are often not quite enough to really end epidemics in these areas at all, because at the end of the day, people are still having to go to work day in, day out. So additional measures like paid sick leave probably need to come into play.
And Jeffrey, we've been hearing how we're all in this together, and we've been saying essential workers are heroes. But obviously, one of the things that's not working is this assumption that everyone can work from home. What would you like politicians to reconsider around that?
I think there's a number of things, really. I think there's been lots of conversations about the importance of creating climates where people do not need to go to work sick. So I think that it's important for us to create environments where people aren't going to the workplace when symptoms are apparent. And I think it goes further. I think that really supporting daycares, I think creating safe environments in schools, and I think providing opportunities for people to go to work, safely is really critical.
And Deputy Mayor, not to put you on the spot, but I have to ask this question because I'm
I'm
sure
good.
people are watching and listening to this conversation. You know, one of the communities that we haven't spoken about are people who are experiencing homelessness, for example. And this pandemic has hit them in ways a lot of us can't even imagine. There's a young carpenter by the name of Khalil Seavright who made these little homes for people experiencing homelessness. But the city of Toronto is now taking him to court. People might want to know why not work with him in finding a solution for people who have nowhere to stay instead of using taxpayer dollars in a COVID environment where every dollar counts to take him to court.
Sure. Sure. It's really important for us to understand what we are trying to do as part of our policy in the City of Toronto. We're trying to remove people from the encampment and putting them into indoor warm environment. We've actually been rather successful at that, but we know that there's a lot of people who need to be continued to be housed and to be sheltered and so on. We are focusing our tremendous amount of energy as well as resource. We're spending, for example, over $1.2 billion on providing assistance for housing for individuals who are in need. It's important also to understand with respect to these particular specific units that you talk about and these particular housing structure that are being built by this individual, they're actually not safe. That is not my word. It is the word of the deputy fire chief. They have actually viewed it to be unsafe. And so I don't think it's a situation where the city of Toronto can actually then support this type of accommodation in our parks and in our facilities. We want to actually remove people from the street and the encampment and put them in places where they're safe and they're well housed and they're warm. That is our effort with respect to trying to deal with this particular problem. We're investing a tremendous amount of resources. We're putting a lot of staff time, and we're actually been quite successful in terms of we've removed a significant number of people from the encampment. And I think it's important for us to ensure that we provide a safe environment for all those who are in need. So when we see a situation in which it is unsafe, we cannot endorse and we cannot support.
And just to push back a little bit, because I think some people
Sure.
might argue that being outside in the cold during a pandemic is more unsafe than being in your own private structure or even being in shelters.
So we believe that it's more important for people to be in a warm environment where there's support and wraparound support, which is what we're actually offering. And so the notion that would suggest that these structures would be safe vis-a-vis the expert opinion, we have to follow the expert opinion. And so I don't think it's a question of not wanting to help people. It is a question of wanting to help them in a safe and humane way. And that is the approach that we're actually taking to ensure that those residents who are in need are provided with the support that they want in a warm environment where they can have, let's say, a nice warm shower, they can have a meal, and can have additional support that they need until we can provide long-term housing solutions for them.
And Nakima, you know, I think one of the common threads in the past year during this pandemic is that a lot of problems that have existed in our society seem to be magnified on the backdrop of a pandemic. In your view, why is the pandemic impacting BIPOC communities in a more severe way?
Absolutely. So we've been having a lot of conversations with folks within our broader policy network about this. And when we started seeing all this data coming out about the overrepresentation of Black communities in the total COVID-19 cases, about the overrepresentation of Black communities in unemployment and job losses from the pandemic, folks around us were saying, none of this really feels new. In fact, it feels like COVID-19 has just exacerbated what we've already been seeing and the outcomes disparities we've already been feeling in our communities. And one of the reasons for that is that we've discussed is that anti-Black racism really serves to marginalize folks. And when you are so marginalized that you are sort of living paycheck to paycheck or on the brink, any sort of shock to your system is going to have a profound make it or break it impact on you and your ability to thrive. Before the pandemic, those shocks were really being felt at the individual level. So, you know, you might have seen community violence in a particular community or a death in an individual family. And Black communities are really good at coming together and supporting one another. But what has happened in the pandemic is now all of these things are happening at once, and these big shocks are being felt across the entire community. And our response to the pandemic is such that lockdowns are disabling the community to be able to come together and support one another. So I think that as we think about why this has been happening, yes, it's systemic anti-Black racism, and it's the way that marginalization has made it really challenging for folks to weather all of the shocks and challenges that are coming out of this pandemic.
And Jeffrey, when we do think about moving forward and how we can build back better, a more equitable society, and given the challenges that we've been discussing in the past little bit, how does this affect our collective economic recovery?
I think every time I hear the word or the phrase economic recovery, I always ask myself, whose economic recovery are we talking about? And so I do think that we need to take a holistic perspective and start to think about populations that historically have been marginalized and that historically have been impoverished to really maintain a high standard of living for particular folks in Canada. And so I think that we've spent a lot of time and a lot of effort, rightly so, on addressing sort of the surface impacts of COVID. I think it's really time for us to start looking at some of the structural issues, some of the deeper systemic structural issues that have been maintaining inequity when it comes to Indigenous peoples and peoples of color in the city of Toronto. And for me, that requires us to focus on stabilizing these families so that they have housing, so that they have the resources that they need, and then to begin to start defining really concrete pathways to sustainable prosperity for children, youth, and families across Toronto.
And Jennifer?
I agree completely with what my fellow panelists just said. None of the issues that have put certain people at additional risk of COVID are new. This pandemic is socioeconomically driven and is also very tied to working conditions. Measures like paid sick leave are being called for in the pandemic, but have been called for a long time because people have always been having to go to work sick and choosing between, staying at home or making their rent that month. And, in the pandemic, there has been research showing that measures like paid sick leave can reduce the rates of COVID-19. There's research out of the US showing that states with paid sick leave measures have lower rates of COVID-19. There's research out of Israel showing that paid sick leave makes people more compliant with public health advice. These measures will help bring rates of COVID-19 down, but going forward, it will also enable people to work in a safe environment and to improve public health overall, because this is not the first infectious disease to come along. It won't be the last. We have flu seasons every year. So these measures really need to be looked at.
Businesses are struggling right now. And I know that a lot of people have been calling for paid sick leave. And the federal government and the provincial government keeps pushing it back to each other. But Jennifer, can businesses afford paid sick leave when they're struggling right now?
Well, I think there's a lot of research out there showing that it's a myth that it's going to cost businesses money to implement paid sick leave, because when you have a healthy workforce, you have more productive workers. And if you think about a worker showing up to the workplace sick, what's going to happen? There's contagion. They're going to spread their virus to their coworkers, who may also become so sick that they will have to stay home and potentially, lose out on their check that month. But infectious diseases are infectious, so if you can't support your workers to stay home, it's going to have a bigger impact on your overall workforce. So there really are incentives for businesses, I think, to take a look at measures like paid sick leave.
And Deputy Mayor, I know that the city has a lot of challenges in recovering from this pandemic, and we're looking at the summer. We're already seeing certain events being canceled. From your view, what would be the consequences of an uneven economic recovery be to the city?
Well, we would be in the same condition that we're actually talking about now in terms of the impact and the effect that it would have on a variety of people, in particular the BIPOC community and so on. And so when we talk about, for example, paid sick leave, which is something that we've been advocating to the other governments for. We're not just simply saying that we put the onus on business owners or small retailers who have been vastly impacted by the pandemic. We're saying that governments should be involved. So it's extremely important that they are involved. Some of the things that we're actually doing here at the City of Toronto, which is extremely important for us also to demonstrate our awareness and tangible things that we're doing. We are actually working with respect to offering training opportunities as well as buying equipment for people who are part of our program. So they have computers, they have connections to the internet and so on. So we change this imbalance in which we are aware in terms of some of the challenges that are impacting the community where people aren't able to work at home in their computers and so on. We are trying to ensure that this unequal economic recovery that could take place doesn't take place. And of course, there's a lot of work to be done. There's no doubt about that. But it's also something that we have to recognize that governments have a role to play. The broader community, businesses have a role to play. Society in general have to collaborate and address the challenges that exist. We know where the problems are. We know what the solutions are. The question is, are we willing and able, are we interested in actually effectively bringing about the needed changes that are necessary in order to have this, inequity that exists in our society addressed once and for all in terms of moving forward? Because as been stated, we will have other pandemics and other types of major challenges, both economic, social, as well as health challenges. Are we prepared? And we should be prepared because there's no excuse in terms of moving forward.
We have less than 5 minutes left, but you said that we know what the solutions are. Can you give us some examples?
Sure. I mean, it's been said, not proper housing, lack of education for a lot of folks, the type of jobs that people are actually doing, the training that are needed. The provincial government made an announcement just yesterday about, providing free tuition for PSWs and so on. That's a really good start. There are other areas in which people will need help in terms of affording, education. It's the high cost of education is also a barrier for a lot of people in terms of getting a good education. We know that going forward, education has always been a key equalizer for many people. I am the product of good education. That's why I'm here to talk to you. That's why I'm a member of Toronto City Council as a Black person living in this city, and who the members of your panels who are people of color, for example, would say to you that a solid education has helped them. So we have to help in terms of these, regards. We have to help single mothers with children. We have to actually help their children so that they can see better and brighter days and so on. So there's a lot of work to be done. And I think collectively, we have to recognize that we have to make the necessary investment in terms of housing, childcare that's needed, as well as activities in the cultural sector and so on to help young people. We haven't talked about young people much today, but we will. There's a 22% unemployment rate for young people in our community. The other thing I wanted to say, and we talk a little bit about COVID. We have 9% of the city's population is Black. 26% of the COVID cases are affecting this community. That's a huge problem in terms of the impact on this community, and we know why, because they're the ones who are actually doing the jobs that can't be done by staying at home on your computer and so on. They're the ones who are at risk. They're the ones who are living in type of housing that is so commingled where they can't separate. And if breadwinner is sick and don't go to work, they don't get paid. So there is the need for paid sick leave. And so one of the other things.
I want to get into. I'm sorry to interrupt you, Deputy Mayor, but I want to get into the other one, the other panelists, because we're running out of time. But I'm sure we will go into our conversation again. Nakima, what do you think of that response?
Yeah. So the one piece that I want to bring in is the Deputy Mayor talked a lot about how the Black community, we are the ones on the front lines doing this work. And as a result, I think we are the ones who should be involved in the policy solutions to support this economic recovery. I think we do a really good job at asking Black communities what the problems are, and then we develop these reports, and then decision makers go away behind closed doors, develop these solutions, and then roll them out into the community. I think Black community voices need to be at the center of not just identifying the problems, but actively co-designing and collaborating on the policy solutions. I think there's been some of that work has started, but I look forward to seeing the ways that the municipal government, federal and provincial governments are going to center Black voices in those bigger policies that are going to actually address the systemic root causes that have resulted in these disproportionalities in the first place.
And Jeffrey, I'll give you the last 30 seconds.
Thank you. So thank you, Deputy Mayor, for bringing up children. All I want to say is our limit for systems transformation and innovation is often, based on the diversity of the people that we have in the room. We've been talking a lot about equity today, and I think that we need to invest in our kids. When the recent UNICEF report card came out, it shows that Canada invests way less in our children than other countries of our size. We need better daycares. We need better schools. We need to be supporting the growth and development and economic prosperity of diverse kids, so they can enter the workforce and add to the toolkits that we have for systems transformation. And I'll just leave it there. Miigwech.
I really do thank all of you for being here today. And there's lots more to talk about. Maybe we can do this again some other time. But I do think that the environment that we're in, the pandemic, it gives us an opportunity to build back better, as they keep saying. Thanks so much for your time. We appreciate it.
Thank you very much.
Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.